Aristotle was born in 384 BCE and lived until 322 BCE. I chose Aristotle because he is a theorist who spread so much wisdom and knowledge that is still relevant and needed today. A significant thing about Aristotle is that he is regarded as one of the greatest minds to ever live and is known as the godfather of evidence-based medicine. One of Aristotle's theories is the concept of equity, which is expanded upon in the Nimachean ethics. Equity is important in healthcare because it recognizes that the black and white of rules, regulations, and policies cannot be applied to the gray area that is known as human life. Aristotle goes on to say that for a system to work, it must provide general guidelines and cannot account for every possibility. He goes on to say that there are some circumstances where the law or policy cannot cover the situation and a special decree must be made. Some of the significant contributions to healthcare that Aristotle made are the concept of evidence-based medicine, equity, and he was a cornerstone of the Alexandria School of Medicine, contributing to the more magical medicinal practices being left in the past. All of these contributions are still evident in healthcare today, especially the concept of equity. Specifically, how a law cannot account for the gray area that is human life. For example, if a clinician is limited to 20 minutes per patient encounter, but he has a patient who has a language barrier, the ethical thing on the individual level would be to take more time to overcome the language barrier through some means such as a translator service or having a family member present to be able to help translate. One important thing to keep in mind when talking about equity is that equity is not the same as equality. And for things to be equitable, some considerations and changes need to be made based on the individual level and not standard across the board.